Hello. Hello.
Hello, yes, ma'am.
Hello. Hello. I think I changed the device. I think you guys are able to hear and I can hear you guys, I think. Right?
Yes, ma'am. Yes, ma'am. We can hear you, ma'am.
Okay. Sorry about that. Have you guys been waiting for me for a long time?
No,
No, ma'am. It's okay, ma'am.
no problem.
Okay. 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 Namaskara. Everyone knows Kannada or Hindi or English?
So English will be only the language we will be using here.
Only English?
Yeah, only English.
Okay.
Yes.
So, shall I start the
No, no,
meeting?
no, ma'am. Just a minute. Dr. Dhammika sir, who is a former commissioner from Sri Lanka government, who will give us an keynote address. Following to that, your
Okay.
presentation will be there.
Okay. No worries. Thank you so
Yes,
much.
yes, ma'am.
Thank
Yes, ma'am.
you. Thank you.
Harshita, over to you.
Yes. Namaste and a very warm welcome to one and all present here. On this auspicious occasion of 10th National Ayurveda Day, we are proud that Tadvidya Sambhasha Parishat is proud to organize this international webinar Ayuh Jagath. Ayurveda, the timeless science of life, continues to guide the world with its holistic wisdom. And today, as we come together across borders and traditions, we reaffirm its relevance in global health and wellness. Without any further delay, let us embark on this enlightening journey with Dhanvantari's Thavana. नमामि धन्वन्तरिम् आदिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरारुभयमृत्युनाशम् आतारमीशम् औषधीनाम् मन्त्रिं प्रमाणार्थम् सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारम् वन्दे पीयूषदायकम् Moving further, every year, Ayurveda Day is celebrated on Dhanvantari Jayanti, honoring the Lord of Health and Ayurveda. Since its inception in 2016 by Ministry of Ayush, Government of India, this day has been reminder of Ayurveda's vast potential in preventive, promotive, and curative healthcare. This year marks the 10th National Ayurveda Day, and the chosen theme reflects Ayurveda's role in addressing contemporary health challenges while strengthening global health systems. It is indeed the celebration not only for a tradition but also Ayurveda's relevance in modern world. To further highlight the essence of this year's theme, we now invite Dr. Narayan K.R. Sir for the theme talk. Over to you, sir.
Doctor. Jivita to proceed. Narayan has some network issue. He'll be joining in 1 minute.
Yes, sir. To formally welcome our esteemed dignitaries, speakers, and participants from across the globe, I invite Dr. Jivita Tapse for the welcome address.
Please unmute. Your mic is muted.
Yes. Sorry for the inconvenience. Shri Gurubhyo Namaha. दधाना करपादाभ्याम् अक्षमाला कमण्डलम् देवी प्रसीदतु मयि ब्रह्मचारिण्यानमुत्तमम्. Shri Gurubhyo Namaha. Esteemed speakers, dear delegates, Ayurveda enthusiasts from across the globe, I extend a warm and heartfelt welcome to you all to this international level Ayurveda webinar Ayuh Jagath, organized by Tadvidya Sambhasha Parishat on the auspicious occasion of National Ayurveda Day 2025. National Ayurveda Day is celebrated each year to honor the timeless wisdom of Ayurveda, the ancient science of life. With this year's theme, Ayurveda for people and Ayurveda for planet. As we gather today, let us reflect on the words of Acharya Charaka, Sarvesham Ayuhu Rakshate Dharmanam cha Samrakshanam. Ayurveda protects life and preserves dharma. This webinar, Ayuh Jagath, aims to foster the dialogue, knowledge sharing, and global collaboration in the field of Ayurveda, connecting minds that are passionate about health, wellness, and sustainable living. It is my great honor and privilege to welcome our distinguished speakers from across the globe whose contributions to Ayurveda are both inspiring and transformative. I now extend my heartfelt welcome to Dr. Dhammika Abhayguna Vardhana Sir, first former Commissioner General of Ayurveda, Sri Lanka, to this webinar. I welcome you, sir. I now extend my heartfelt welcome to Dr. Rekha Aniprasad Ma'am, the pioneer of two enterprises, CEO Mount Sinai Virtual Hospital and CEO of Prosevo Wellness Space, Perth, Australia. I welcome you to this webinar, ma'am. I now welcome Dr. Aditya Purushottam Indani sir, founder of Radha Krishnan Clinic and Instagram health influencer, Maharashtra, India, to this webinar. I take the privilege in welcoming Dr. M.S. Sajivane Pereira Ma'am, Consultant, Stri Roga and Prasuti Tantra, Unit Head, International Relations Unit, Department of Ayurveda, Colombo, Sri Lanka. I wholeheartedly welcome you to this webinar, ma'am. I take the privilege to welcome Dr. Sanjay Gowda Sir, BAMS, MD Scholar, second year, SDM Institute of Ayurveda, Hassan, Karnataka, India, to this webinar. I wholeheartedly welcome you, sir. I take this privilege to welcome, heartfelt welcome to Dr. Saurabh Kokatnoor, sir, founder of Tadvidya Sambhasha Parishat, to this webinar. I extend my heartfelt welcome to all the participants, delegates, Ayurveda enthusiasts, to you all. May this webinar be a source of knowledge, inspiration, and collaboration, strengthening the global community. Let us now embark on this journey of wisdom and wellness with gratitude and reverence. Yat kritam karma phalam bhavet lokanam hitam arthatah tasmad asti mama vinayah sarvebhyah namah sadaiva. Thank you. Thank you so much, Dr. Jivita. Moving forward, now we come to the most awaited session. I request Dr. Janvi to kindly introduce our keynote speaker, Dr. Dhamika sir, to the webinar.
Good evening, everyone. It's my immense pleasure to introduce Dr. M.D.J. Abhay Gunawardena as distinguished figure in the field of traditional medicine. Dr. Abhay Gunawardena's career is marked by his extensive administrative experience spanning 29 years in the traditional medicine sector in Sri Lanka. He is the former First Commissioner General of Ayurveda for the Ministry of Health, Sri Lanka. His leadership extended to multiple key organizations, where Sir has served as the former chairman of Ayurveda Medical Council, Ayurveda Education and Hospital Board, the Ayurveda Research Committee, and Ayurveda Medicine and Production Regulatory Council. Beyond his administrative role, Sir has made a significant contributory to health policy and education. He served his duty on the National Health Development Fund and the National Dangerous Drug Control Board. He was also a key member of Advisory Committee of the National Medicinal Regulatory Council and the UGC Higher Standing Committee for Traditional Medicine. His commitment to academic is evident through his roles as a council member for the University of Sabaragamuwa and the Gampa Vikramacharya University of Indigenous Medicine. His expertise has also had a global impact. He has been a pivotal figure in WHO activities, providing technical support for the development of WHO benchmarkers for Ayurveda training and WHO International Standard Terminology on Ayurveda. As a WHO collaborative project focal point and project manager for Sri Lanka, he has pioneered revolutionary reformers to the country's traditional medicine system. Please join me in extending a very warm welcome to Dr. M.D.J. Abhay Gunawardena, sir. We welcome you, sir.
Okay. Have a pleasant evening and namaste. Thank you for my introduction. I need a slideshow option. Can you allow to me?
So you can start presenting, so you are allowed.
But it's is it working? No.
Yes, sir. It is working, but you are sharing the screen, it seems. You have to switch to your slides, sir, in the screen.
Yes.
Yeah. Yes, sir. Yes, sir. It's visible.
Now visible. Okay. Again.
No, sir. It got stopped. I think you pressed the stop sharing key.
Now it's okay.
Yeah. You please switch on to your PPT mode, sir. Yeah.
Now it's okay.
Yes, sir. Yes, sir. We are able to. Yeah.
Okay.
Yes.
Thank you very much for invite to this special World Ayurveda Day 2025 as a keynote speaker. And an introduction, I think my colleague expressed who I am. I first thank you, the Narendra Modi ji, because this is the 10th National Ayurveda Day in India, but now it's dissolved to the other countries, and in this year Sri Lanka also we celebrate the World Ayurveda Day 2025 in today morning. When we come to my topic, my topic is Ayurveda to the globe. Why Ayurveda for planet? Because you know that our vision, the Ayurveda Day vision, you very well known it. Why for the planet? I'm going to express my understanding or my view why Ayurveda for planet is a personal health and global well-being, ecological balance. For why? Sustainable development. In the current situation, we are always talking the sustainable development. When we go to the UN, they mentioned that the SDG, Sustainable Development Goal. But in the few earlier era, we try to introduce the people to the go to the moksha. But in today, the modern world, we are talking about the sustainable development. That is why the Ayurveda day more important to the planet, because uh, Ayurveda day is an opportunity to take uh, individual and reform it the role in the global health. Now we are facing in the more health challenges in current era because our habit, because we are not thinking the personal health. Not only that, according to our habit, we are trying to involve the global well-being, and most of the time we can see what happening out of us and around the world, around the countries, and we are in the big uh, we are in a big unbalanced situation. That is why what the India discovered the Ayurveda day nationally, now it's go to the internationally. This is the sentence what today your honorable minister says in the AIIA in the uh, Goa. Ayurveda is not just a healthcare system, it is a science of life rooted in the principle of harmony between the individual and the environment. Now you can understand, according to our knowledge, according to what our guru says, who is the individual and what is the environment. The modern science, they not concern the environment. Always they are thinking the individually the most prominent part of this world, but they are not concerned the environment. But in the our science, Ayurveda is based on environment. It started from the Panchabhuta. After that, it gives the birth, and we live sometimes 60 years, sometimes 100 years, but after that again we go to the Panchabhuta. This is the very advanced and very conceptual, meaningful term Ayurveda. You know what is the Ayurveda? I am not going to express that the word of definition in Ayurveda. When I come to the system of medicine, first I come to the India system of medicine, Ayurveda, Siddha, Unani, and Swarupa. When you come to the Sri Lankan system of medicine, Ayurveda, Siddha, Unani, same both countries, because in Sri Lanka we imported the Ayurveda, Siddha, Unani from India and other countries. Same like in India, we have the Desiya Chikitsa. We are thinking in Sri Lankan Desiya Chikitsa is a more powerful than other systems but we don't have textbooks. The proven by the archaeologists, this is the textbook, but the Ayurveda, Siddha, Unani, we have the textbook because we give the more prominent place for the Ayurveda, Siddha, Unani. Anyhow, when you come to the Sri Lankan context, under the Ayurveda umbrella, Ayurveda, Siddha, Unani, and Desi Chikitsa all are come to the one umbrella. But when I go to the India, it's not like that. It's a little bit different. Under the Ministry of Ayush, they're thinking separately. But when you go to the other countries, it's not like that. But they are not using the Ayurveda. There are so many systems of medicine. These are few examples for you. When you go to the Chinese traditional medicine, plus the moxibustion and acupuncture. When you go to the Japan, there is a system of acupuncture and the moxibustion. Mongolia, traditional medicine, traditional Mongolian medicine. Iran, and traditional Persian medicine. Sometimes is different from the Unani. Korea, traditional Korean medicine. North Korea, Oreo medicine. Germany, phytotherapy, homeopathy, anthropopathic. Australia, Aboriginal and terrestrial island traditional medicine. Why I am saying that? Most of these medicine, these medical system based on plant. Ayurveda also based on plant and nature. These are the often localized practice developed by scientific culture. All the countries they have their own culture, and there are communities, the beliefs and religious activities, and the pattern of food and other behavior, and they are using local herbs, plants, and the spiritual healing under the traditional medicine. Now we are to when we are come to the India, is a more prominent part is the Ayurveda, Siddha, and Unani. Therefore, normally we use Ayurveda for globe, Ayurveda, National Ayurveda Day or International Ayurveda Day. Anyhow, when we come to the Sri Lanka, in that word Ayurveda, everything included. Not only Sri Lankan medicine, Ayurveda, Siddha, Unani, Sri Lankan traditional medicine, all Asian countries, their government recognized medicine is available in Sri Lanka. We are recognized under the Ayurveda name. That is the difference. We are in Sri Lanka, we are very open for the traditional system of medicine in this planet, in this globe. And next we go to the why Ayurveda for globe. This is the, I think one day I present this presentation little bit deeply in AIIA in Delhi. Just I want to say you, the global Ayurveda market is a growing industry. An estimated $4.5 billion in 2019. However, now the projected uh, estimated dollars 14.9 billion 2026. Now after a couple of months we are entering 2026, but we have to revisit and relook, and we have to think about that are we achieve this, because India play more role for the global Ayurveda. I know the vision of the Indian leader, heal in India and heal by India. According to that vision, the India can go. India now started go other countries through the medicine, not only through the service. Finally, with the human resources. And when we come to the compound annual growth rate, CAGR of it is 16.14. The market includes various segments. You know that when we go to the internet and you can see in the traditional system of medicine, the products, most of the product we use for the skincare. I think you have the good knowledge about this when you come to your country, and when you go to the other countries in Sri Lanka, Australia, and other countries, more people they wish to use skincare product for the whitening, for their beauty, hair loss, so many conditions. They are using the traditional medicine product, herbal product. They think all herbal products are natural, but I don't know. This is open for you. And oral care. Number 2. And medical treatments. You know, in the traditional system of medical treatment, little bit, you know that is not the familiar to the Western medicine. If there any disease, the Western medicine, the people diagnose and they give some pills. Is very easy to use. But in our system, it's not like that. Because why? Because we are not the treat the disease, we are treating only the patient with the dietary modification. Without, we are not going to touch with the patient without the diet. Our protocol and procedures based on the diet. When we analyze by the region, with a key interest in the North America, Europe, and the Asia Pacific is more prominent. They wish to continue Ayurveda or herbal medicine for their conditions, their ailment, their issues. But we have to think again and revisit how you're going to promote, how you're going to introduce Ayurveda for globe, for easy way, because the current situation, that this era, the people are very busy. People are not like the ancient time. They are very busy. There are no time because people they try to earn money. They don't have the time. Therefore, we have to revisit, and this is the more opportunity for this type of dialogue, and we can revisit and we can introduce to the people uh, to the easy way through our system. When we come to the challenges, there are I identify the main two challenges, but we can explore it more. But today I'm going to categorize only two. One is the regulatory challenges. You know that the India, they have regulations. In Sri Lanka, we have regulation, but country to country, there are so many regulations. Some regulations came under the Ayurveda's view, Ayurveda scope, but some regulation came with the other medicines and other system and other country regulations. I can give one example. If we need to send the medicine to the Japan, sometimes some medicines are not allowed to Japan. There is a regulatory issue. Sometimes the medicine can sell other countries. Sometimes we can send as a medicine. Sometimes we can't send as a medicine. Sometimes we can send the food supplement. This is the regulatory challenge, but we have to think and we have to open the forum and we have to discuss it. I think is the top level discussions, and already we started with discussion with your minister, your secretary in the Ayush and other top level meetings, and we had a special meeting with the last WHO session also in Geneva. And number two, product standardization and efficacy. The product standardization is a very essential one, because always now the current new era, new people, new generation, they think the standardization. When we come to our product, the standardization is a little bit different, difficult. Why difficult? We should have to go to the where we are going to pick the plant, and we have to think of soil, we have to think of water, we have to think of environment and all the things. And after that, when we come to our factory, and we have to think about the GMP and the HACCP, and after that the WHO guidelines and so many things. And we have to think when we come to the product standardization for efficacy. Without efficacy, if we have the good medicine, but people not believe it, people not use it. Sometimes they start to use and they refuse. Therefore, this is the more important things. These two challenge in today, the 10th National Ayurveda Day and the Global Ayurveda Day, we have to think these two. But this is the policy makers should be take these two challenges, what I'm going to dialogue with you, and after that they should have to give some solution for this, and after that we can think our future. I think now we should have to start scientific validation and research. Without research, we can't say. Not only the research and development. Sometimes research is there. All the university, I know, all the universities, all the masters people, they have the research. But what happened when they complete their research? Sometimes it's go to the cupboard, not come to the development side and not the tangible product. Without that, I think this is the big issue for us. When I come to the World Health Organization's view, the WHO always saying like this, evidence-based medicine. This is the big argument. When I am in India, when I am in the so many forums, what is the evidence-based medicine? What is this? I think most of the people think evidence-based medicine for the disease. Are you agree? But I am not agree that our system is not depend on the disease. We are depend on the patient. And when we develop evidence-based medicine for disease, is it okay based on our textbook, based on our fundamental, based on our practice? This is the today what I am going to say with you. Please open your eyes. What is the evidence-based medicine? Now I am open this evidence-based medicine with your eminent Professor Bhushan Patwardhan, and we open to the dialogue with the WHO. Evidence-based medicine, not for the disease, it should be based on what the textbook says, what are our fundamental, what is our practice, why we are going to treat the patient, not the disease. I think always we are talking about the drug mafia. I think, according to my knowledge, when I am as a Commissioner General of Ayurveda in Sri Lanka, we are talking the Western medicine, Western side, the allopathic medicine, there is a drug mafia. It is not like that, the same in our system also. Anyhow, again we have to think evidence-based medicine. In this 10th National Ayurveda Day, I think these colleagues, I think you are eminent professors, my friends, dear friends, again you have to think what is the evidence-based medicine, what is this, why for that, and how you're going to introduce into the patient, not the disease. I think this evidence-based medicine more prominent after the COVID pandemic. Always we try to find a medicine for COVID disease, but according to our textbook, according to our fundamentals, again we have to revisit what happened to the patient. Okay, this is my last slide. Why we are promoting Ayurveda to globe? Ayurveda or traditional system of medicine, we are based with the nature. If we protect the nature, it should be goes to the sustainable development goals we can achieve. If we protect the nature, if we think the nature, if you respect to the nature, and this is the one part of the we can achieve the sustainable development goal. But in Ayurveda, we are always talking of science of life. Science of life is in that sentence, there are so many things are there. If we achieve the science of life, we can go to the moksha. This is the, we introduce to the globe. And if we have to, this dialogue, today's session, we can introduce to the globe. That is the achievement of today activity. And thank you, all of you. You invite to me as a keynote speaker. I try to eye open you again the evidence-based medicine and how we introduce the globe. Thank you very much again, all listeners, all who arranged this activity. Thank you.
Thank you, sir, for your enlightening address, which truly set a tone for the rest of the session. Ayurveda for people and planet. Now, to further highlight the essence of this year's theme, we now invite Dr. Narayan KR for the theme talk. Over to you, sir.
Namaste everyone. On behalf of Tadvidya Sambhasha Parishat, I am here to welcome you all for this webinar, Ayuh Jagath, conducted on the occasion of National Ayurveda Day. Since the inception of Tadvidya Sambhasha Parishat's objective has been to revive and promote the traditional Gurukul system of learning, of knowledge and transfer of knowledge to the younger generations. With the same intention, today's webinar, Ayuh Jagath, has been organized on the occasion of National Ayurveda Day 2025. This year, the celebration holds a special significance as we mark the 10th anniversary of this important day. And for the first time, it is being celebrated on a fixed date, that is September 23rd, aligning with the autumnal equinox, a beautiful and fitting symbol of balance, which is the very heart of Ayurveda. The theme of National Ayurveda Day 2025 is Ayurveda for People, Ayurveda for Planet. So, from my perspective as an Ayurveda doctor, this theme is very important, and this is not just a slogan. It is a profound call for action. So it's beautifully encapsulated, and it is the timeless wisdom of our science, which emphasizing the health of our intrinsically linked health, and that health which is being linked to the health of the environment. So in the world of grappling lifestyle disorders like diabetes, hypertension, stress-related diseases, Ayurveda offers a sustainable and holistic solution. So we guide our patients on the principles of Dinacharya, Rutucharya, teaching them how to eat, sleep, live in harmony with their nature and natural rhythms. The focus is always on the prevention, on building a strong foundation of health so that the disease finds no foothold. So this is where our ancient science and text comes into practice, where as a powerful tool when compared to the contemporary system of medicine. So, but this year's theme broadens our view from the individual to the collective, to the very planet we are inbuilt. The principles of Ayurveda are inherently eco-friendly. Our medicines are derived from the nature, from herbs, roots, minerals, and with respect to the sustainable ways. When we recommend a remedy, we are also enforcing and reinforcing a connection to the earth. So the health of our soil, the purity of our water, the cleanliness of our air are not just environmental issues. They are the health determinants. So they determine what the health of an individual is all about. A toxic environment leads to a toxic body. This theme, Ayurveda for People and Ayurveda for Planet, reminds us of our responsibility to advocate for a healthier planet. It's a call for us to practice and promote sustainable living, to cherish our biodiversity, and to custodian the natural resources that are very foundation of our healing science. As Ayurveda doctors, our role is expanding. We are not just healers now, we are the educators, researchers, and advocates. We have a duty now to demystify our science, to validate with the modern science, to integrate it ethically with the contemporary science. When I say integrate ethically, it means that we have to keep our principles intact. Along with that, we have to validate so that the whole globe is ready to accept what the science of Ayurveda actually holds. The growing recognition of Ayurveda on a global scale, with its principles being adopted in the different countries, as our previous guest speaker has very clearly elaborated what is the need of globalization of Ayurveda as in different countries. So it is a testament to its universal relevance. So we must continue to build on its momentum, showcasing its viability, evidence-based system for the well-being of all. So for achieving all the above, the team of Tadvidya Sambhasha Parishat is committed to this ancient science, dedicating ourselves to serving the patients with compassion and also to share the wisdom of Ayurveda to all the future generation. So Tadvidya Sambhasha Parishat has come up with many future plans already to achieve these goals, like making diploma courses in different forms of Ayurveda, like in Garbha Samskara, in Shara Sutra, in prenatal and antenatal care, in cosmetology and trichology. So which we are also tying up with many universities abroad, India and abroad. So where we'll be giving the interested candidates a valid certificate of the course, which they'll confidently use it in their practice. And also we are aiming in making a trust of Tadvidya Sambhasha Parishat, so that everything that the activities that we are conducting is under a valid umbrella, which is valid over all over the world. It is not confined to only India also. So with this few words, I would like to thank all the speakers for their patience hearing, also for the organizers for giving me this time to share my thought on this theme. And also I would like to bring to the notice that this Tadvidya Sambhasha Parishat has been conducting and has been sharing this objective for the past 7 to 8 years from its inception in 2017. So except that few years during the COVID, we have been doing this regularly on a daily basis, where we have about We have brought many delegates from India all over the globe as well, where many delegates from Sri Lanka had joined, from Nepal, from Philippines. So all these activities are like a part of globalization, which we've already started. So even though the theme of Ayurveda, National Ayurveda Day, has now promoting towards globalization, we have been doing this from a very long time. That is from 2017, since the inception of Tadvidya Sambhasha Parishat. So without taking much of the time, so I thank everybody once again. Jai Dhanvantari, Jai Ayurveda.
Thank you, sir, for your insightful words. Now we proceed with the scientific session where eminent experts will share their wisdom and experience. To commence with, our first speaker is Dr. Rekha Ani Prasad. It is my
Can you
great pleasure to introduce today's distinguished guest, Dr. Rekha Ani Prasad. Ma'am is a renowned physician, innovator, and a healthcare strategic advisor with over 25 years of experience in transforming clinical care models. As the CEO of Mount Sinai Virtual Hospital and Prazivo Wellness Space, she is leading the integration of virtual care. Ma'am is leading the integration of virtual care, AI, genomics, and wellness medicine to deliver advanced, patient centered healthcare systems. Consultant physician at Sri Charles Gardner Hospital, Mount Hospital. Ma'am is also a visiting medical officer, clinical lead for geriatrics in Western Australia, and whatnot. A pioneer in healthcare innovative, Dr. Prasad has spearheaded the evolution of hospital in the home into an ambulatory medical ward model, shaping the future of the virtual healthcare delivery. Her work during the COVID-19 pandemic led to the development of protocols for safe, scalable, community-based care, treating over 1,000 patients globally across Australia, India, Europe, and Africa. Ma'am is a global voice in shaping the future of integrated care delivery. She advises health system and government on virtual care models. She has spoken at international medical conferences on the topic of diabetes, management of alcoholic liver, dementia, and cognitive rehabilitation. And ma'am has given about 10 health topics in ETV. With her expertise at the intersection of complex medicine, strategic health design, digital innovation, and precise medicine, ma'am is a key person of influence in digital health, genomics innovation, and system-wide healthcare transformation. Please join me in welcoming Dr. Rekha Ani Prasad to today's event. Welcome, ma'am.
Thank you so much. And I'm so privileged and blessed to be in the presence of such esteemed people today. I feel really blessed. And thank you so much, Saurabh, for inviting me for this exciting event, I should say, because I have been thinking about sharing my experience from a global perspective of what I think about Ayurveda and how I have been using Ayurveda in my journey into medicine. So, thank you so much. Can I share the slides, or I can just keep talking because I don't want to?
Please.
Can I share
Yeah,
this?
you are allowed to share, ma'am.
So, uh, can you see me sharing the slides? Uh,
No, ma'am.
uh, Second, resume your presentation. Resume your presentation. Yeah. Can you guys see my presentation?
Yes, ma'am. Yes.
Yep.
Yeah.
Okay. Thank you so much. Thank you. And is it able to move the slides? I'm trying to change the second slide.
We will operate the slide changing here.
Okay, okay. Yep,
Harshita,
don't worry.
please take care of the changing the slides and present from your end.
Yep.
Okay, sir.
Okay. I acknowledge the traditional owner. I would like to begin by acknowledging the traditional owner of the land on which we meet today. I would like to pay respects to the elders, past and present, and I seek the blessing of everyone present here from my Janmabhoomi, Bharat, and from my Karmabhoomi, Australia. Thank you once again. And this is an exciting opportunity for us to say that this is a time for global acceptance of Ayurveda and the future of integrated medicine. Leading the two organizations, that is, as I mentioned, the Mount Sinai Virtual Hospital and Prajivo. Prajivo is a baby that has come out of my upbringing from India and being born in a traditional family of the Ayurvedic Veds in my grandmother's family from Kerala. So the word Prajivo means it's path for life and vitality. What we have decided here in Australia is to start the beginning of a new era in healthcare. This is an Australian based healthcare system. We have integrated the cutting edge technology. From the background that I have is an allopathic MBBS degree with fellowships, with the advanced training of the physicians and super specialty in obstetric medicine, geriatric medicine, perioperative medicine, and lifestyle medicine. I'm also a board certified a lifestyle medicine practitioner from America. So this has been a melting pot of all the knowledge where we are currently using the genomics, advanced comprehensive biochemical and imaging, data driven analytics to do the diagnosis, merging with the microbiota analysis, paving the way for precision medicine along with the Ayurvedic principles, which has been the core basis of our civilization. Let us also not forget that Ayurveda is nothing but the modern principles that has been evolved in the last 3000 years. It is so aptly said by Professor Damika that it is nothing but a personalized medicine with prakriti and then gut and microbiome metabolism, which Agni suggests the Agni part of your Ayurvedic stream, epigenetics and lifestyle medicine, as well as holistic and preventive medicine. We are standing here at a historic inflection point in the healthcare. For centuries, humanity has sought answers to healing through science, philosophy, and tradition. Today, we hold the privilege of witnessing a convergence where ancient wisdom meets the cutting edge innovation, where Ayurveda embraces the genomics, the regenerative medicine, and quantum science. I'm proud to be a physician, a healthcare strategist, where I see the global system no longer can work in silo and in an isolated way. It is time for both sides of the medicine scholars to join hands, to collaborate, to integrate and bring the best of both the worlds, to encourage, to form a new model of medicine. Why global acceptance of Ayurveda matters? Ayurveda, we all know that it has been a 3000 years of validated clinical wisdom. It's the principle of balance, prevention, lifestyle, and personalization, aligned perfectly with today's challenges. As a physician, I say chronic diseases, stress, mental health, aging, all intertwined, and with the complexity, it's really hard to tease. And as Professor rightly mentioned that we, from the allopathic side, we are very good at giving medications without giving the whole holistic approach of diet, lifestyle, sleep, and stress. And as we all know, we are looking at sustainable healthcare, we are looking at sustainable living, we are looking at ecological way of dealing with a balanced, well accepted way of healthcare. The global system are seeking low cost, high value intervention. And this is exactly where the Ayurveda can fit in, supported by clinical validation and clinical rigor. As the previous speakers have rightly mentioned, the challenges that Ayurveda is having, the skepticism due to lack of structured evidence based trials, and as there has been a lot of work going on in this world of Ayurveda, I see that there is an opportunity here to build a momentum between Ayurveda and modern scientific framework by bridging and establishing the clinical based trial, like clinical centers where the the scholars from both the world sit down, draw the protocols, have the evidence based medicine, and do the biochemical and the imaging and the genomic markers pre and post intervention. And this is where we come. In Australia, we have been the first beacon of merger of the world class precision medicine, AI driven, uh, the allopathic medicine, bringing the evidence based rigor into the community, along with our thirst of global regenerative and holistic health platform. We at Prajivo, we have dedicated at bridging the Ayurvedic integrated medicine, regenerative therapy, and global clinical research standards. We are going to be serving as a platform where scholars, scientists, and clinicians can collaborate. Our vision is to integrate a medical curriculum where the student of medicine studies Ayurveda along with the molecular biology, quantum physics, and regenerative medicine. I know this is a bold vision that I'm throwing to the forum here, something that you can take home and think about where we can, as a group of scholars and clinicians, can come and start to put the seed of redefining healthcare for the global platforms. Here is the inflection point: quantum and regenerative medicine. This is where I love medicine because it is rapidly establishing its evidence. And here in the current era of our scientific advancement, we have been able to actually establish that yoga and meditation can actually give the regeneration of stem cells. We are able to establish those data driven scientific evidence so that we can support that 3,000 years of the old wisdom has got solid science. So I think it is time that we are just not entering evolution, we are entering a revolution of the medicine. And this is the most exciting time to be in medicine, with every practitioner bringing in so much of current knowledge, especially in regenerative medicine, as it is redefining how do we treat medicine. With stem cells, peptides, and biologics are unlocking self anti aging. Quantum medicine is something which is brand new in the horizon of the medical and scientific knowledge base. It is an emerging aspect of the science and technology. They are using physics and establishing energy and vibration and consciousness to explain what Ayurvedic and traditional systems have been spoken for centuries old. And this has been evidence based now that healing is not just a hearsay or a placebo effect. It is more than biochemistry and bioenergetic. The future is no longer see a divide between science and spirituality, or the allopathic or the traditional medicine of Ayurveda or Chinese medicine or the bush medicine. I think it is time for us from the world of allopathy and the traditional medicine to join hands and get the best evidence based data out to the world that is wanting to have a change of the way we do healthcare. Integrating Ayurveda and quantum medicine frameworks offers a new lens of understanding where ancient terminologies actually translates into measurable modern science. I have a vision for global health and integrated curriculum. This is a bold vision I've come in today that everyone who is at this forum have a think, because this is a seed for all of us to think. And sometimes big visions start from a silly, bold, stupid person making a big long comment. So I come with a vision of having a medical school for the future where the student learns the pharmacology and Ayurvedic herbal pharmacopoeia along with anatomy, physiology, biochemistry, along with prana and energy channels, quantum fields and vibrational medicine. We learn about surgery, regenerative therapy, peptide therapy, and genetic crisp and genetic remodeling of the genomics that has got to offer, along with a very strong foundation of nutrition, meditation, and lifestyle sciences, which becomes the bedrock of all the healthcare that we are going to be providing. This is not an alternative medicine. This is the medicine of the future. We, as the scholars from all over the world, we have to be able to redefine medicine. It is about integrating, it's about building a medical system that is whole, inclusive, foolproof, with evidence, bringing everyone from all avenues of life to walk together. This is like planting a seed for future and the future generation. Ayurvedic scholars, global physicians, policymakers, our role is not to defend traditions, have a fight or an argument about our principles are greater or their principles are greater. It's about bringing in the best from both the worlds with the evidence for the new generation to be able to justify why we are doing and what we are doing. We must seed integrated medicine curriculum, global regulatory frameworks, and collaborative clinical trials. Establish clinical trials in the Western world, like, for example, in Australia, so that with the regulatory ethics committee approval and all the things that are governed for the allopathic medication trial, the Ayurvedic and traditional medicine have to go through those rigorous trials to that, so that we can prove to the rest of the world that there is evidence here and we have been able to establish the medicine that has been working for so many thousands years in a proper evidence based format. This is the time to define a new era of healthcare where no patient is left behind, where wellness is a priority over disease management, and where medicine finally becomes what it always meant to be, the art and science of healing. I stand here not only as a physician, but as a global health influencer, bringing forward the vision of Prajivo, that is path of life and vitality, along with my Mount Sinai Virtual Hospital. The aim is to have this as a globally connected virtual hospital to unify healthcare, to advance holistic regenerative models, and to inspire a world where ancient wisdom and modern science are no longer separate languages but one universal dialogue. The inflection point is here. So let us help to define the future together. Thank you so much for giving the opportunity, and thank you for the patient hearing.
Thank you, ma'am, for your inspiring words on Ayurveda's global presence. Thank you so much. It is a distinct honor to introduce Dr. M.S. Sajivane Parere, a distinguished consultant in Stri Roga. This is our second session. Ma'am is a consultant in Stri Roga and Prasuti Tantra and head of the International Relation Unit at the Department of Ayurveda. Dr. Pereira holds a BMS degree from the Institute of Indigenous Medicine, University of Colombo, along with an MSc from University of Kelaniya and MS Ayuh in Gynecology and Obstetrics from Gujarat Ayurveda University, India. Programs, delivered lectures and developed projects like one Organ Prasuti OPD and IPD clinics at National Medical Sri Lanka short-term training programs on research methodology, project, proposal writing, and quality control techniques. She has also published several research articles in reputable journals on topics like managing uterine fibroids, Ayurvedic diet principles, and efficacy of certain Ayurvedic formulations. Additionally, Ma'am serves as an editorial board member for the national journal Ayurveda Samiksha and as a secretary of the International Relation Unit at the Department of Ayurveda. Please join me in giving a warm welcome to Dr. M.S. Sajivani Pereira. Welcome, ma'am.
Present, or should we proceed with presentation?
Yes, thank you very much for your nice introduction. Shall I share?
Yeah, ma'am, please, please. Vaishnav, you can stop sharing. Ma'am, please proceed with your slides.
Sorry, can you share it behalf of me? It is difficult to share.
Vaishnavi, you can restart sharing Madam's PPT, please.
Yes. Thank you so much. Good evening, all the faculty members, colleagues, and students. Tadvidya Sambhasha in Ayurveda Day 2025. So today I am going to present a subject-specific topic, but it is a global burden. I believe this is too high time to discuss with this topic in the international forum. Management of cervical cancer in young women through Ayurveda. Next slide, please. So, before starting the Ayurveda management of cervical cancer, I would like to draw your attention for 5 alarming statistics and the prevalence of the cervical cancer. So coming to the global context, global level, the cervical cancer is 4th most common cancer in women in the global. According to the 2018 statistic, 570,000 women were diagnosed in cervical cancers and 311,000 died from this cancer. So coming to the regional level, the most new cervical cancer cases, 55% in Asian region and the 21% in African region. So when we come into the Sri Lanka statistic, according to the National Cancer Control Program, data revealed that the cervical cancer cases are 45%. However, the screening participation rates for cervical cancer in Sri Lanka is only 50% to 70%. Cancer incident has more than double in Sri Lanka in the last 20 years, rising from 151 cases per 100,000 in adult population in 2021. When we consider about the India, the cervical cancer is the second most frequent cancer in the women in India. According to the 2022 data, estimated 127,526 new cases were diagnosed with the over 77,000 deaths annually, and also in India, approximately 1 in 53 Indian women during their lifetime will occur to the cervical cancer. So the unfortunate thing is that the cervical cancer is one of the most successfully treatable forms of the cancer, and when it detected early, it can manage effectively, and also the cervical cancer is 100% preventable cancer. Next slide, please. By 2030, WHO goal is to reduce the incidence of rate of cervical cancer to below 4 for every group of 100,000 women. Unfortunately, not many countries are on track to meet the WHO goals by 2030. The WHO target is to end cervical cancer by 2030. You can see these red color areas of the global map. It is represented in the African region countries. So the incident rates remain the highest in the African region and also the African region countries. Next slide. Yeah. When we move to the risk factors of the cervical cancer, I will explain briefly that the most common factor is human papillomavirus, HPV infection. The most common factor is HPV infection, and HPV type 16 and 18 are directly linked to the cervical cancer as well as and the persistent infection with the high risk HPV type is a major risk factor for developing cervical cancers. So then sexual activity and sexual history, the start in sexual activity at the young age increase the chance of HPV exposure and ultimately leads to a cervical cancer. And also the multiple sexual partners, also having multiple sexual partners also increase the chance to export the different HPV types, and the partner's sexual history also increase women's risks of the infections of the HPV. Next, please. And another risk factor is smoking. As you know, smoking tobacco increases the risk of cervical cancer, and it also leads to prolonged HPV infection, and also the weak immune system like HIV, AIDS, like diseases to affect the immune system, and also it also risks of the developing the cervical cancer. And the like herpes, chlamydia, gonorrhea, syphilis, HIV, AIDS, like sexually transmitted infection can increase the risk of HPV infection. So it also leads to cervical cancer. And Have you heard the diethyl estradiol? It was a powerful synthetic estrogen. It is prescribed to the pregnant woman to prevent miscarriage and the preterm labor. So, if the mother took the medicine DES, a child risks of developing a specific type of the cervical cancers. And the other factor is reproductive factors, the oral contraceptive and the multiple pregnancy also associated with the increase of the cervical cancer. Next slide, please. Then here, the long-term untreated cervical erosion according to Ayurveda, we called as Garbhashugivagata Bruna or Karani Yoni Vyapat. So you can see these pictures. So how to serving the cervical erosion and the cervical os and the upper lip of the lower lip of the erosions and the outer normal cervical squamous epithelium is there. So on other side, you can see the flat erosions, papillary erosions, and transparent discharge with erosion. Any type of cervical erosion often present symptoms of the chronic inflammations or the infections are risk factors for the cervical cancer. That's why untreated cervical erosion, long-term chronic inflammation or inflammation is risk for the cervical cancer. Next, please. Moving to the stages of premalignant cervical lesions. So abnormal cell changes, the abnormal cells on the surface of the cervix, these lesions are actually not cancerous themselves, but they can progress to cancer if they are not detected and treated early. By cervical interepithelial neoplasia, CIN, is a pre-malignant cervical lesion that progresses through the 3 stages, CIN1, CIN2, CIN3. Each stage indicate increase the cellular abnormalities inside the cervix epithelium. Next, please. Next, please. Yeah, these are the stages of the CIN. So as I mentioned earlier, CIN1 actually it's a low grade. It's a 1/3 of the epithelial thickness shows the abnormal cells, and the low grade squamous interepithelial lesion is in the CI1. Actually, it is often resolves on its own without the treatment. CIN2 involves abnormal cell affecting between 1/3 and 2/3 of the epithelial thickness, while CIN3 is a severe form. It's actually abnormal cell affect more than 2/3 of the epithelium, and it also include, we call it carcinoma in situ, but the abnormal cells have not yet invaded surrounding the tissues. It is CIN3. These are the stages. Next, please. So you can, this picture you can see very clearly how to speculum view. With the first in you can see the normal cervix, and then how to spread cervical cancer, and so also bleeding or stages 1B, 2B, 3B, like that, how to cervical cancer become progress. You can see this. Next, please. Yeah, it's a very important detection and screening. Actually, detection and increase in pap smear. Pap smear is a screening test that can detect the abnormal cells on the cervix, including those Ayurveda plays a significant role for managing the cancer. Coming to the Ayurveda management, Actually, it is very beneficial for several aspects. The prevention, palliation, increase in quality of life, enhancing calls for these parts, the parasurgical procedures, it means Shara Karma and Agni Karma are the most effective treatment for cervical erosions. I no need to explain these things because Shara Karma also help to destroy the abnormal endocervical columnar epithelial that protrudes into the exocervix, and it is Shara Karma and Agni Karma. Also, Agni Karma we use as we know Swarna Shalaka or Tamra Shalaka or Panchalo Shalaka. The terminal therapians too, it also destroy the abnormal columnar epithelium. It also promotes wound cleansing and enhance tissue generation and leading to healing the cervical erosion. So we can, through the Ayurveda, we can totally cure the cervical erosion. Long-term cervical erosion may cause to cervical cancer, but we can, early stage, we can manage it. Next, please. I will show you some evidence-based research evidence related to the Shara Karma and Agni Karma. Here, among the 18 research works, so 10 works are related to the Agni Karma and 7 works related to Shara Karma, and 1 work comparing Agni Karma and Shara Karma. That study result revealed that both having better results. And the Agni Karma achieve profound therapeutic effect in managing cervical erosion. And the below you can see before and after treatment, you can see the cervical erosion. The below one related to the Shara Karma, and the other one is the picture of the Agni Karma. This both having very good results, and also that studies tested the local preparation, especially we are using after the Shara or Agni Karma, Jatya Ditail, Udumbara Ditail, Yashtimadi Chur, Nishadi Chur, having wound healing properties were tested also. These are the evidence and evidence-based research result for the effects, for the therapeutic effects of the Agni and Shara Karma. Next, please. Yeah, here Rasayana Chikitsa, you know, various herbal drugs have been proved to be the beneficial for preventing and reversing the progressions of the cancer. It's a very important is the reversing the progressions of the cancer. The Shatavari, Ashwagandha, Bala, Nimba, Haridra, Amalaki, Vibhidaki, Haritaki, Guduchi, Tulasi, Shunti, Shigru, Shankapushpi, Ashtimadu Brahmi, all are having Balle, Brungana, Rasayana, Vajikarana, and some of having the latent properties as good as well. But these help to reversing the progressions of the cancer. These drugs are very important herbs for the managed cervical cancer. Next, please. Yeah, this coming to the local Sthanic Chikitsa, so local treatment, so specific to the gynecological disorders, as well as it's also we can use for the prevention of the cervical cancer, Yoni Davana, Yoni Varti, Yoni Pichu, Yoni Dupana, Yoni Lepana, Yoni Purana, as well as Uttaravasti. So these local treatments helps to moisturize and lubricate and they nourish the tissues, promoting healing, and also reduce the inflammation and strengthen the cervical and vaginal canal. Therefore, this is a very important for as well as prevention as well as the curative aspect. Next, please. Then coming to medications that are used in Ayurveda procedures and their evidence-based effect is specific to cervical erosions as well as the cervical cancers. Here I have already mentioned 16 herbal medicines. And their effect. Which are already proven by the scientific research. Those are the evidence-based. According to this research, these herbs having the antimicrobial, antibacterial, anti-inflammatory, wound healing, antioxidant, anti-carcinogenic, anti-immunomodulatory, anti-ulcerative, and neuroprotective effects. Please go through next slide. And all these ingredients we can use for these are you can see that we can use for the Loni Lepa, Praklarana, Pichu, so Dupana, or as Isthanika Chikitsa. So it is also very important because they have their properties, their effect have already scientifically proven. So we can those drugs for our Sthanika Chikitsa to cure or the prevent or the cervical cancer. Next, please. Next. Yeah, coming to next, Sattavaja Chikitsa. Actually, this is also the very important part because the mental and emotional states of the patient is directly correlate with the cancer. Cervical cancer, especially in breast cancer, cervical cancer, it's a directly correlated because the chronic stress condition promote tumorigenesis and oncogenesis through the production of stress hormone, the activation of the inflammations, and the suppressions of the immunity. So the yoga and meditation is the very important for to reduce the stress. When if stress is reduced, it is reduced to tumorigenesis and oncogenesis and reduced to product stress hormone and it may and suppress immunity as well. So it's a very important part to manage the cervical cancer as well. Next, please. These are the some yoga asana for the cancer patient, like Supta Bandha, Konasana, Shukasana. I'm not explaining depth all these things. These asana are good for the cancer patients. Next, please. Yeah, then this is also the evidence-based research result for the therapeutic effect of yoga and cancer. Actually, this study was of the 15 studies, 5 exposed to yoga, effect on the patient with the cancer. Actually, in here, 4 of which were in the breast cancer. And this study results found a favorable outcome for inflammation after the yoga intervention, and also the effects on the biomarkers, and also the significant reduction of the cortisol reduction, and also systematic review of literature showed the efficacy of yoga intervention on reducing levels of inflammatory biomarkers and the individual with chronic inflammatory condition, including the chronic stress. So it's very important part, and we have evidence, research evidence to therapeutic effect of the yoga in cancer as well as cervical cancer. Next, please. Then panchakarma treatment. So coming to panchakarma, you know, it's a potential to prevent recurrence. You always vitiated dosas, eradicate from the body, never relapse, never recurrence. So and it also restoring balance and it strengthen the immunity, and it can create an internal environment less conducive to cancer growth. It's a very important, and it also helps to improve the quality of life, and it helps to reduce chemotherapy and radiotherapy side effects like nausea, fatigue, weakness. Next, please. Then the panchakarma, then as you know, many research studies report revealed that the interconnection between the inflammation and the cancer. So, you know, identification of transcription factors such as the chemical, they are gene products such as tumor necrosis factors, interculins, chemokines, and also vascular epithelial growth factors. They have the molecular basis for all of inflammation in the cancer. We know about that. These inflammatory pathways can get activated by, as I mentioned earlier, smoking, tobacco, stress, dietary agents, obesity, alcohol, infectious agents, and environment stimulations, then its pathways can get aggravated. So according to Ayurveda, the inflammatory process is manifested in the manifestation of abnormally increased the pitta dosha. We know it. There are panchakarma inhibit growth of the cancer stem cells via reducing inflammation. So it is emphasize that the panchakarma, shodhana karma is very important. They plays a major role in the management of cervical cancer. Next, please. Yeah, it's a managed cancer cachexia. It is a very important because Ayurveda view of cachexia is consequent impaired Agni. And so accumulation armor or the depletion of the dhatu. So this leads to the symptoms of cachexia, including weight loss, muscle atrophy, and fatigue management strategies focus on addressing these root cause through personalized treatment plans. And it's also focus of Amapachana, Agni Deepana, and Rasayana Chikitsa very important. So I'm coming to my last slide. Next, please. This is the integrated non-invasive management of cervical low-grade squamous epithelial lesion, antimicrobial followed by oral curcuma longa extract. So you can see the coloscopy and pap smear changes in cases before and after, and improvement and regression to pap smear and the coloscopy changes. With this, I am reached to end of my presentation, and this is, I can conclude that we have a lot of approaches, very successful treatment protocol through the Ayurveda to manage cervical cancer. Thank you very much. Thank you very much for your attention and this opportunity. Thank you.
Thank you, ma'am. Thank you for your valuable contribution on this significant subject. Now we commence our third session. It's my immense pleasure to introduce our today's notable guest, Dr. Aditya Purushottam Indani. Sir is a BAMS MD scholar with experience in the hospital industry, having worked as a resident doctor at Poda Hospital, Mumbai. With valuable qualities like confidence and empathy, he is making a mark in healthcare. As a health influencer on Instagram with 35K followers, Dr. Indani is known across Maharashtra for his unique theoretical format of teaching. He has conducted over 20 skin special lectures in more than 10 cities and has bagged several awards for his work in theatre and scientific presentations. With expertise in diagnosing, treating, and counseling patients, along with a special interest in skin and hair lesions, Sir is a team player with excellent communication skills. Apart from these achievements, Sir has been awarded as Best Actor Vidwamban Natya, Best Director and Writer Vidwamban Natya. Also, he is the host for Doordarshan's Hello Doctor program. Please join me in giving a warm welcome to Dr. Aditya Purushottam Indani. Welcome, sir.
Okay, thank you so much. Am I audible and visible?
Proceed.
Okay, so straight we'll start our session. Utility of Basmas in Ayurveda General Practice. My name is Dr. Aditya Indani and I'm Director of Radha Krishnan Clinic and Panchakarma Center, Dada West. So, without wasting a single second, I'll straight away take you to most important symptom in your general practice. That is fever. Okay. So before dealing with any type of fever, you should ask yourself questions. That patient sitting in front of you is of which type of fever? You should always ask yourself, am I dealing with what type of fever? Like we in clinical practice go this way. Am I dealing with viral fever? Am I dealing with bacterial fever? Am I dealing with malarial fever? Am I dealing with enteric fever? Or am I dealing with amoebic liver abscess related fever? If you don't find any of this cause, start scratching your head. Maybe the cause is different. It is not viral, bacterial, malarial, enteric, or amoebic liver abscess. Maybe it is related to tuberculosis related fever or HIV related fever. If not above, again start scratching your head. So I initially started with infectious type of fever, then I turned to chronic fevers, and now, if not above, you can also think of autoimmune disease related fever, just like rheumatoid arthritis or systemic lupus erythematosus or other connective tissue disorders. And if not above, again start scratching your head and always think of fever which are out of the box. Like in India or some interior parts of Maharashtra, we have Rocky Mountain fever or well Felix positive type of fever. Or in some parts of India, we also have Kala Azar related fever. So you should always think out of the box if you don't find any of these causes. So this is autoimmune, this is chronic, and these are acute causes of fever. But for now, for today's lecture, we'll also look for pathology related to jwar or fever with respect to Ayurveda. You know the first line, Malastatra Swe, Swera Dushtaha Pradushanehem. Amashayam Pravishya Ama Anugamya Pidhayacha. Third line is very important. Pakti Stanacha Nirasya Jwalanam Bahi. It means the Pachak Pitta inside your stomach is thrown out in other aspects or other parts of body causing fever related symptom. Now this is the pathology. And what is the general Jwar protocol or acute fever protocol is this. Langanam Swedanam Kalo Yavagus Tiktako Rasa Pachananya Vipakvanam Doshanam Tarune Jware. But for now, for today's topic, I'll introduce you to one of my favorite drug, and which is used for high grade fever. That is none other than Praval Bhasma. So this is the slok from Rasatarangini, and if you see third line, Tridosh Shamanam Balyam Vishesha Kafavatanut. And if you see last second line, they have also mentioned Shayakas Haram Chaiva Rakta Pitta Pranashanam. So these are the qualities or these are the gunas for Praval Bhasma mentioned in Rasatarangini. But if you look or if you dive down into the Ayurveda text, you will find few more references related to Praval Bhasma and Praval Pishti. But most of the time, when patient comes to you with high grade fever, you can directly prescribe Praval Bhasma or more specifically Praval Pishti. Also, if the patient is of dengue related fever, now dengue, if not complicated, is very easy to treat. 4 to 5 days, you may have high grade fever. Fever will subside on its own. Then after that, 6th, 7th, 8th day, your platelets will start increasing. But what if your dengue fever converts into dengue hemorrhagic fever, causing extravasation of fluid, leading to capillary leakage and coagulopathy, bleeding, hemoconcentration high, or thrombocytopenia, or dengue shock syndrome, fluid loss, hypotension, and so on. So, to prevent your dengue getting converted into complicated dengue, like dengue hemorrhagic fever or dengue shock syndrome, you can definitely use Praval Pishti or Praval Bhasma. This is the reference from Rasatantra Sar, which is a compilation for all the Rasa Granthas. And they have mentioned in Praval Pishti that Praval Pishti or Praval Bhasma can be used post Langan for Deepan purpose, can be used for Tivra Jwaravek. Suppose someone is having 103, 104-degree fever, you can use Praval Bhasma. If Jwar with Pitta Pradhan Lakshan like Daha, Brahm, and so on, you can use Praval Bhasma with Guduchi Sattva. And for Visham Jwar, temperature if 103, 104, you can definitely use Praval Bhasma. And lastly, our favorite or our highlight indication is Rakta Pitta. As I have already mentioned that Praval Bhasma, Shay Kas Haram Chaiva Rakta Pitta Pranashanam. Most of the dengue fever will go into dengue hemorrhagic or dengue shock syndrome, or they will have pathology similar to Rakta Pitta. So to avoid that complication, we can definitely use Praval Bhasma because Rakta Pitta as an indication has been mentioned in Praval Bhasma with reference to Rasatarangini. If you ask me the dosas for Praval Bhasma, I'll tell dose should be within 60 milligram to 100 milligram, or you can go above 100 milligram also, depends on case to case. So this was all about Praval Bhasma. What you need to remember is Praval Bhasma can be used for Rakta Pitta and also for Tivra Jwar Veg, and when there is Pitta Pradhan Lakshan respect to fever. So this was Pravar Bhasma. Now we'll study one more topic, that is headache. Very common in general practice. Oh, I have also mentioned a picture, Laila Majnu. This was a famous film which was re-released just a year back. If you haven't experienced headache in your life, you can watch this movie. I'm just making fun to keep you on edge of your seats. But yes, you can watch Laila Majnu film if you haven't experienced headache. The whole point of the movie is not ending it quickly. So again, if you discuss with me headache, we'll go step by step. In viral fever also, you may have headache. In malarial fever also, you may have headache related symptom. For sinusitis, very common. Headache is very common feature. For meningitis, again headache with neck rigidity, very common. For subarachnoid hemorrhage, yes, patient might present with headache And again, neck rigidity. In books, it has been mentioned that it is the worst headache of life. For subarachnoid hemorrhage, there is a line mentioned in most of the textbooks that it is worst headache of life. Now, there is one more type for headache, subdural hematoma, neurocystic cirrhosis, tuberculoma. So, last three or four causes of headache are with fits. So if patient presents to you with one fit, and he's complaining of headache, always think of subdural hematoma if patient is old. Neurocystic cirrhosis, Christian guy eating pork, very common. Neurocystic cirrhosis, very common. Tuberculoma, mild headache, mild other symptoms, and feet. So these are the causes of headache. Most of the causes are dangerous and most of the causes may need hospital admission. Are you thinking of brain tumor and headache watching Indian serials? You can think of it, but that is most rare cause and that can be kept last in the list. So, which is the most common cause of headache in your general practice? Apart from all this, I'll say the most common cause is migraine. Migraine is such a common cause for patient presenting in general practice. Now, migraine. Here I have written migraine is a complex disorder characterized by recurrent episodes of headache, most often unilateral and in some cases associated with visual or sensory symptoms, which is known as aura in migraine. Now, my clinical experience says migraine patient knows they will have headache in this day. Like if even if they have woke up early in the morning, they are brushing their teeth, they want to go somewhere, but while brushing their teeth, they might know that around 3 or 4 they might have their migraine related headache. Very very common in your practice. But which is that bhasma which can be used in migraine or other headache related symptom. So I'll introduce you to one more bhasma of today's lecture, and that is Go Danti Bhasma. Beautiful drug, beautiful drug. Most of the bhasmas are used in 30 milligram per day, 40 milligram per day, 50 milligram per day. But this Godanti bhasmas can be used from 2 ratti to 8 ratti. Basically from 250 milligram to 8 ratti if you calculate. So Godantam, Sumrutam, Shitam, Pitta Jwara Nishudanam, Jirna Jwarharam, Balyam, Deepanam, Shwasa Kasanut has been mentioned in Rasatarangini. But I'll take you to one more reference. Godanti can be used in headache 100% yes. Now, which type of headache? Any type of headache, you can add Godanti in your pudi or Shirashul, Surya Avarta, Ardhava Bhedak, or patient feeling of heat overhead, you can add Godanti in your prescription. I'll tell you the base prescription for Godanti. Godanti 1 gram plus 12 gram plus milk 12 ml BD or TDS can be given for all causes of headache. And if it is related to Kafat Shirashul, add Godanti with Samir Pannak 50 milligram. Now, Samir Pannag is again a Somal Kalpa, which you will study with Panchasut and Malasindur. But with respect to Kafat Shirashul, add a Godanti with Samir Pannag. So, this was the second Bhasma of today's lecture. Earlier, we talked about Prawal Bhasma, which can be used for Tivra Jwar, and Godanti, which can be used for headache related symptom. Now, we'll study one more topic, which is very interesting and very common in general practice, Bram or vertigo. If you look at the allopathic aspect of vertigo, you'll have central causes of vertigo, peripheral causes of vertigo. And in peripheral causes, the most important cause or most common cause is benign paroxysmal positional vertigo. Along with BPPV, you may have causes related to acute vestibular neuronitis or acute labyrinthitis, or perilimb fistula, Meniere's disease, and so on. So basically, peripheral causes of vertigo are related to your ear. Now, what about central causes of vertigo? In central causes, most common is cervical spondylosis, or maybe something related to cerebellar pathology, because cerebellum maintains the balance. There are four important things which maintains the balance: your eye, your cerebellum, your posterior column of spinal cord maintains the balance. Now, when we look at the central causes of vertigo, you may have causes related to cervical spondylosis, maybe anxiety, depression, cerebellar pathology, epilepsy, and so on. But when we look at the Ayurvedic aspect, that is Brahm, you should dig into the basics. Like in Vata Vruddhi, Pralapa Brahma Dinata has been mentioned. So Vata Vruddhi can cause Brahm? Yes. Second important, Kapha Kshay can cause Brahm, Kapha Brahma. Yes, the second important cause for Brahm is Kapha Kshay. Now, most important, Majjakshay can cause Brahm. Yes, it has been mentioned in the shlok of Majjakshay that yes, Majjakshay can cause Brahm. Now we'll look at the Rasa Sevan. Fourth important is Ati Katuras Sevan can cause Brahm. Pitta Vruddhi, Ati Katuras Sevan. Yes, Ati Katuras Sevan can cause Brahm. Ati Tiktaras Sevan can cause Brahm. But most important, I think this is mostly ignored, but Amlaras, when consumed by Krusha person, it is mentioned in Ashtang Sangra, Amlaras in Krusha person can be the cause of Brahm or vertigo. So these are the causes of vertigo. When you look into the clinical practice, when you go step by step, these are the general causes of vertigo. But we are studying bhasmas. Now, which bhasma can be used in vertigo? Let's see. So this is my next slide. Abrak Basma. Oh, what a Basma. What a Basma. See, in the first line they have mentioned Snigdam, Param Shishiram, Swadu, Ayushagram. Ayushagram has been mentioned. Keshyam, Varnyam, Ruchikara, Malam, Deepanam, Chatibalyam has been mentioned. But if you see fifth line, or fourth line, Kshetrak Stairya, stability in the body has been mentioned under the gunas for Abrak Basma. So you can use Abrak Basma in Brahma related symptoms. Answer is yes. But I'll tell you the direct reference for Brahma. And the next Basma is Rajad Basma or Ropya Basma. If you look at the other indications for Ropya Basma, second line says Paramasya Medyam. Yes. And in fifth or seventh line, I have underlined it, Brahmahari Visheshena. Brahmahari Visheshena has been mentioned for gunas in Rajat Bhasma. So maybe Ropya Bhasma, Abraka Bhasma, or this type of Bhasmas can be used in Brahma related symptom when you deal Ayurvedically in general practice. So this was all about Abrak and Ropya, which can be used in your practice when patient complains of Brahma. Now, I'll tell you dosage for Abrak and Ropya. As I said, Praval Pishti can be used from 60 milligram to 100 milligram, and for Godanti, it is 2 Ratti to 8 Ratti. And now for Abrak, it is 20 milligram to 30 milligram. For Ropya, it is 10 milligram to 20 milligram. If you're giving it for acute cases, you can increase the dose of Ropya to 30-40 milligram per day also. But see, there's one more reference which is not our topic, but you should remember that one drug, this Dhamasa is a ekal drug which is mentioned in Chakradatta for Brahm. So you can combine your Abrak Ropya with Dhamasa Churna and give in a packet format for per day dosage, which will benefit you in a very good amount. But I have also mentioned one more thing. Pitta Prakop Janya Brahm, Swarna Makshik can be the drug of choice because Swarna Makshik is Shita and Pitta Kaf Shamak also. So this was all about Brahm. Abrak can be used, Roppe can be used, for headache, Godanti can be used, for Tivra Jwar, Praval Pishti can be used. Let's see. The next topic is very interesting. For all the people who are attending, next topic. I hope you're finding interesting, but next topic is very interesting. Now, look at the shlok. Viruddha, Adhyashana, Ajirna, Amecha Purnaz, Pishta Apakwana, Madhyanam, Gorasasya, Guru, Abhishandi, Bhojyanam, Veganam, Dharnasya. Looking at the hetus of this present slok, you might think it is the hetu for some kapha related disorder, or maybe some santarpan related disorder, because Pishta Anna, Guru Anna, Abhishanda Bhojan has been mentioned. But I tell you, according to Kashyap Sahita, this is the slok from Kashyap Sahita. If you read Amla Pitta, they haven't mentioned Ushna, Tikshna, Katuras, or other such masala related products in the first or second line. They have mentioned it in fifth or sixth line. But for first two line, they have mentioned Guru, Abhishandi, Pishtanam, Madhyanam, Gorasasya. It means Amla Pitta is not only Pitta related disorder, it is Kapha Pitta related disorder. And when they have mentioned Pishta Anna, Guru Anna, it means that this all the annas can disturb your Agni first and cause Pitta Prakop later on. Maybe. So this is the shlok from Kashyap Sahita. So you might have understood our next topic is Amla Pitta, and this was the highlight point, but more highlight point is this. Symptoms of Amla Pitta. अविपाक क्लमोत्क्लेश तिक्तोम्लोद्गार गौरवे रुद्रकंठदाह aruchi amlapittam vadeta bishak. Yeah, they have mentioned, but you see, in the first line they have mentioned avipak tiktamlodgar has been mentioned in third or fourth sentence, but avipak means indigestion. And then second they have mentioned klama. What do you mean by klama? Having weakness, generalized weakness without doing physical activity. Clum as a symptom has been mentioned in Amla Pitta. But you will say, what is that bhasma or which is that bhasma which can be used directly in Amla Pitta? Now, this is the bhasma. Swarna Makshik Bhasma. Very interesting. Swarna Makshikam Vrusham Maduram Turasayanam. Tiktam Swaryascha Chakshushyam Tridoshagnam Parammatam. See, Tridoshagnam Parammatam. Then in the third line, Shayam Arshasi Mehani Vivida Basti Vedana. Fourth line, very interesting. Pandu Shavatu Kushta. I'm using it lot in Kushta Kushtani Visha Doshadi Kana Hareta. Then last, Jirna Jwara, Apasmara, Mandagni, Arochakam, Anidra, Nashetyashu, Yogavahi. This Swarnamakshik Basma is Yogavahi. But yes, you can use it in Pitta Kapha related disorders just like Amla Pitta. So if you look at the references or if you look in Rasatantra Sar or other books, you will find direct reference for Swarnamakshik in Amla Pitta. So if your Amla Pitta is Pitta Pradhan, then Swarnamakshik is your drug of choice. And if your Amla Pitta or acidity has caused GI ulcers and this GI ulcers are bleeding, then Swarnamakshik can be the drug of choice. See the paradox. Amla Pitta, when GI ulcers, bleeding, Swarnamakshik. Pitta Pradhan, Amla Pitta, Swarnamakshik. What is the dosage for Swarnamakshik? I have mentioned 60 milligram to 250 milligram per day dosage for Swarnamakshik. Yes. So this was one more basma for Amla Pitta. But I'll introduce you to one more. See, I think he's Vicky Kaushal holding Eno packet. Do you guys know this Eno, which works in 6 seconds? Everyone says Ayurveda works slowly, but Eno is an Ayurvedic product. It has got Sarjik Shar. And reference for this Eno, that Sarjik Shar, when added with some amount of water, will reduce Amla Pitta symptoms in no time, has been mentioned in Rasa Tarangini. So this Sarjik Shar, or this related product or Sarjik Shar reference has been mentioned in Rasa Tarangini. But I'm not taking you in this direction. I'll show you one more reference for Amla Pitta, and that is Shankha Bhasma. You can use Shankha Bhasma in Amla Pitta because Shankha Bhasma is Shar, acid Kshar, acid, alkali getting neutralized. Simple logic. Shankam su shitalah. Shara Amla Pitta Vinashanam. In the first line only, they have mentioned that Shankabhasma can be used in Amla Pitta. For second line, they have mentioned Agni Mandeharo, Balyo, Grahi, Grahani Karaha, Parinamotho, Shula, and other such symptoms. Also, Tarunya Pitika has been mentioned as a gun or as a feature for Shankabhasma. And you should use it in Tarunya Pitika or acne when there is post inflammatory hyperpigmentation, not in the initial phase when there is inflammation and papular lesions. Okay, anyways, our topic is Amla Pitta and Shankabhasma. But I'll take you to some other topics also. Now, this slide is the most important slide of my lecture. Shankhabhasma can be used in Atisar Grahani along with Nimbu Ras, 100% yes. Shankhabhasma can be used in Agni Mandya with Trikatu Charna, yes. For Amla Pitta, you can use Shankhabhasma along with Amal Ki Churna, 100% yes. Shankhabhasma can be used with Panchalavan Gud or in place of Gud you can add Trikatu Churna for Parinam Shul, 100% yes. So this slide is very important. You can have multiple indication with respect to Shankabhasma while changing the Anupan. For Atisar Grahani, Nimburas, for Agni Mandya, Trikatu Churna, for Amla Pitta, Amal Ki Churna, for Parinam Shul, Panchalavan Gud, and so on. So this was our Shankha Basma, which is important for Amla Pitta. Swarna Makshik, important for Amla Pitta. Now, next topic is very interesting. Maybe last second or last topic, but next topic is very interesting. I just have 7 or 8 minutes, but these 8 minutes are very important. Now, see. Oh, if you read this slok, we don't have much time to read slok, but yes, I'll tell you the highlight point. See, I have marked with the pen Astik Shatam, Astik Shotam, Janga Asti Vedana, then Astik Shosha. See, this Astik Shatam, Shotam, Janga Asti Vedana, Astik Shosha, four indications for Asti. It has been mentioned for Swarna Basma. So in your general practice, maybe patient is not affordable, or maybe if it is affordable, you can use a Swarna Bhasma when there is joint related manifestation. Just like this, if there is Astik Shata, use Swarna Bhasma. Astik Shota, you can use Swarna Bhasma. Janga Asti Vedana. You can use a Swarna Bhasma. And lastly, Astik Shosha. So if they are mentioning four indications related to Asti, it means Swarna Bhasma has something for Asti. So for osteoporotic patient or osteoarthritic patient, if they are comfortable and affordable, do go for Swarna Bhasma because osteoarthritis patient will later on land into fixing of joints. Maybe they won't have movement by taking painkiller also. No relief after taking painkiller, fixed joints are the indications for surgery. But till the time they go for surgery, because if you perform early surgery, it carries highest amount of mortality. But any redo surgery, again, highest amount of mortality. So you can delay the surgery by using such bhasmas like Swarna Bhasma or other such Ayurvedic drugs and other such Panchakarma procedures which are used in day-to-day practice. So yes, Swarna Bhasma is indicated for osteoporotic, osteoarthritis and other such in AOC, normal bone matrix, bone with osteoporosis. Very interesting. Very interesting. So this was Swarna Bhasma. Now our next Bhasma or next indication. Oh, asthma. See, most of the patients, like in Mumbai, it is an Anupadesh, and I practice in Mumbai. Most of the patients coming to me for breathlessness, cough, and wheeze. This is the triad for asthma. Now, most of the stomach shock patient will feel better after they travel to their native places or after they shift to their native places. I'll tell you the reason behind it. Change in geography causes relief in symptoms. It is there for asthma. Now, for our Ayurveda aspect, that can be Vata Pradhana Tamak Shwas or Kapha Pradhan Tamak Shwas. But in both the aspects or both the things, you should remember that there is obstruction in the bronchus. The pathology is very simple. Yada srotansi sanrudyam marutah kafapurvakah विश्व विश्व व्रजति संरुद्धस्तथा श्वासान करोति सह. So this is the samprapti for shwas rog, that there is obstruction with cough, and this vyadhi or shwas vyadhi, which can be vata pradhan or kapha pradhan, but this vyadhi is amashay udbhav. It has got base in the amashay. Now, which basma you will use in Shwasarog or Tamak Shwas? Very simple. Everyone knows. It is very interesting. That is, oh, I have Shwas protocol. Just suspense for 1 second. Yad kinchit kapha vataknam ushnam vatanaloman. This is the protocol for Shwas. Beshaj pan annam taditam Shwas hikkin. Basically, they are talking, if you want to treat Shwas, at least do these things. The drug you are adding or the anna you are adding or whatever you're giving, it should be kapha vatagnam, ushnam, and vatanaloman. Basically, it should carry this features kapha, shamak, ushna, and vatanaloman. Now, which is that basma which can be used in shwas or tamak shwas? Very interesting. It is Samir Pannag. Samir Pannag. Now, Samir Pannag is kapha vata related pathology. You can use Samir Pannag. I started using Samir Pannag in urticaria in initial my PG days, and I got very beautiful results because some of the cases of urticaria are of Shita Pitta. Basically, Samir Pannag is Kaphavata Shamak. But in the book of Yogo Joshi sir, there's a beautiful line. They have mentioned my second point. If there is Vata Vikruti in Kafastan, so this is the Kafastan, and there is Vata Vikruti, go for Samir Panna. So basically, it can be used for Vata Pradhan and Kapha Pradhan, both the things. Yes, mostly for Kapha Vata related pathology. Mostly, if there is obstruction, you can definitely go for Samir Panna. Now, third interesting point is this: it stimulates the respiratory system and causing expectoration of the cough. Yes, Samir Pannak does this thing. And you can use Samir Pannak, which is the Somal Kalpa. And with respect to Panchasut and Malasindur, it is very mild. With being a Somal Kalpa, it is very mild comparing to Panchasut and Malasindur. Those are very Tikshna. Now, Samir Pannak dosage is very important. 20 milligram to 30 milligram per day is the dose for Samir Pannak. Now, you can add Godanti also, Samir Pannak, Godanti, Haritra, Shunti can be your pudi, or Shwasakuthar, Samir Pannak, Talisadi or Sitopaladi can be your pudi format drug. Next, interesting, Basma. So, along with Samir Pannak, if you're talking about kapha thing, you should also remember that Tankan is Katu Ushna. And in the second line, they have mentioned Kafo Vishleshano. It means it is same as Samir Pannak. Even Tankan, as a we can use it for gargle purpose. Tankan is Kafo Vishleshano. And this is another point when we are discussing Shwas or Kapha Pradhan or Vata Pradhan, Tamak Shwas. Next interesting Bhasma. Yashad Bhasma. So after discussing Shwas, after discussing other GIT related diseases like Grahani and Amlapitta, we have come to the last aspect of my lecture, Yashad Bhasma. Now, I started using Yashad Bhasma. I used to use in skin disorders earlier, but today's topic is general practice. So I'll tell you last line where I've underlined with pen that Kampa Vata Paham Chaiva. Yeah, you can use the Yashad Bhasma when there are tremors. So Parkinson's patient presenting to you with tremor, Kampa Vata Paham, Yashad Bhasma can be used. So you can add Ropya, which goes for Mastik Jagat pathology, Ropya, Yashad, Kapikachu Churna as your single drug formulation for Parkinson's? 100% yes. But I want to take you to some different topic related to Yashad Basma. In the last third line, they have mentioned Vranastrava Nirodhanam. And Yashad Basma, it is very beautiful drug when there is Vranastrav because it decreases the secretions. It can be also used locally according to Rasadarangini along with growth. It can be also used locally when there is Vrana related pathology. So Yashad Bhasma for Vran, Samir Pannag for Tamak Shwas, Tankan for Kapha Vishleshan. You should remember this when you're practicing or when you're doing general practice with respect to Ayurveda, and basmas are important. Now, next. Oh, so I won't go into much detail, but this pathology or this picture physiology is of healthy erythropoiesis. And healthy erythropoiesis is possible when there is iron, when transferrin transports iron from the liver and in the bone marrow. So basically, transferrin transports the iron from liver to bone marrow for healthy erythropoiesis. And iron is a key agent for hemoglobin formation. Now, if you see Loha Basma, it is very obvious that Loha can be used for anemia. There are multiple causes of anemia. You can go from iron deficiency, B12 deficiency, mixed anemia, sideroblastic, pregnancy related, hemolytic, aplastic, and so on. But when there is iron deficiency anemia, or when there is Pandu, when you have diagnosed with respect to Ayurveda, and if there is Pitta Pradhan symptoms also, you can add Loha Basma to it. But Loha Basma in Pandu, very obvious. But I'll take you to one more important point. See, in the second line, they have mentioned Rajorodham. Rajorodham. Rajorodham can be an indication for Loha Basma in the initial phases of menstrual cycle. Yes, yes, you can use it. You can use it in Kamla. Yes. Halimak. Yes. Firanga. Yes. Loha Basma can be also used when you are like when you are better from the disease, but there is Stana Vaigunya or Kha Vaigunya. To get over the Kha Vaigunya, you can use Loha Basma in your practice. So Loha Basma in anemia, very obvious, but other indications like Amvat, Asti Vikruti, Loha Basma, yes, you should try these things also. Okay, Loha Kalpas, Navayas Churna, Tappedi Loha, Punarnava Mandur, and so on. Oh, pathology for Pandu, and they've mentioned Rakta Medasko Nisaraha. Yes, and that is why we are adding Loha Basma in the prescription. Oh, next is very interesting. Seborrheic dermatitis. It is caused by yeast. Okay, seborrheic dermatitis and nasolabial fold, eyebrows, central chest, upper back can be involved. But you see the before and after picture. I have achieved this results in just 3 days by using bhasmas. Now, which bhasma for seborrheic dermatitis? First, understand that this Arun Shika has been mentioned in this Yog Ratnakar as Bahu Kledini, and which has got Kapha dominance, Krumi dominance. So basically, we need some drug which is Kapha Pitta Shamak and Krumi Shamak also. So Swarna Raj Vangeshwar. So in the slok they have mentioned Sleshma Amaignam, and for Rasatantra Sar they have mentioned Arun Shika also as the indication. So Swarna Raj Vangeshwar for infective cases, 100% yes. You can use in UTI. You can also use for hydradenitis suppurativa. You can also use for pyoderma. Also abscess anywhere in the body. Oh, I am this is KL Rahul picture. He after scoring a century said, "This is my ground. This is my area." There was a reference from Kantara movie. So yes, the skin is my area. I'm just telling. Oh, okay. So again, erythrodermic psoriasis, Vata Kapha dominant pathology. Which basma you'll use for skin disorder? Rasamanikya. Yeah, Vividanicha Kushtani has been mentioned for Rasamanikya, and Rasamanikya is Hartal Kalpa, which is Vata Kapha Shamak. Definitely can be used in skin disorders when there is Vata Kapha related pathology. So many Vasmas I have told you are related to Rasamanikya, Swarnaraj Vangeshwar, Tankan, Samir Pannag, and so on. Now, my maybe last slide. Kasi's Basma. Oh, I'm using a lot of Kasi's Basma for hair also for androgenetic alopecia because it increases the Raktakan. And wherever you need Ranjan, just like in vitiligo, need Ranjan. So you can use Kasi's Basma in your prescription. Yes. Okay. In androgenetic alopecia, Kasi's Basma works beautifully. So ultimately, I just want to end with some philosophical message. So I've added this: drop the idea of becoming someone because you are already a masterpiece. You cannot be improved. You have only to come to it, to know it, to realize it. So realize we have greater such bigger science and great bhasmas in our practice which can be used very smoothly and beautifully. Okay, so your general practice or any practice depends on these three things, which I believe first is knowledge, obviously. Honesty, very important. Honesty. Without honesty, you can't have a peaceful sleep, obviously. So honesty is important. And lastly, judgment. Yeah, judgment is very important in your general practice or any consultant practice also. Judgment is very important because patient comes to you after roaming everywhere. So judgment is important. So these three things are important. And lastly, thank you, Saurabh sir, for allowing me to speak in this international Ayush Jagat seminar. And thank you everyone for patiently listening to me. I've placed all the bhasmas with references and with few of my experience also. And also, I want to thank Saurabh sir again because my national seminar, my start of national seminar was with Tadvid Sambhasha, and my start for international seminar is with Tadvid Sambhasha only. So thank you so much, Saurabh sir, for allowing me, and thank you everyone.
Thank you, sir. Thank you so much for this enlightening session. And I hope everyone loved your session. Thank you so much, sir. Now, moving on to the next session, we proudly present our own senior, Dr. Sanjay Gowda, sir, who is the alumni of Ayurveda Mahavidyalaya Hubballi and is pursuing his second year MD in SDM Hasan in the Department of Kriya Sharira. Presenting to you, Dr. Sanjay Gowda. Over to you, sir.
Hello, I am audible. Is PPT visible? Hello.
Yes, yes, yes. Make it full screen.
Okay, thank you. Hello, good evening, everyone. Myself, Dr. Sanjay Kumares, second year PG scholar, Department of Roga Nidhana from Esteem College of Ayurveda, Hassan. Today, I am going to speak about role of semen analysis in current Ayurveda medical practice, guided by Dr. Saurabh, Associate Professor, Department of Samhita from AMB. These are the contents I am going to cover today. Coming to introduction, why we need to interpret semen analysis in terms of Ayurveda, because semen analysis is a widely used diagnostics tool for male infertility in modern medicine, where it gives.
Slides are not visible. I think by mistake, Damika sir is presenting his slides. Sir, can you hear me? Damika sir, can you hear me? Sanju, you can represent your slides. Yeah. Make it full screen. Make it full screen.
No.
We can see, but it is not in presentation mode.
No, fine, sir.
Yeah, it is. Yeah. Now your slides are visible. Go ahead.
Okay. Coming to introduction, why we need to interpret semen analysis in terms of Ayurveda, because semen analysis is a widely used diagnostics tool in modern medicine for male infertility. It gives important information like sperm motility, sperm count, sperm morphology, like that. But in Ayurveda also there is a enormous data on like Shukra. Why? How the Shukra guna is explained. Then Shuddha Shukra Lakshana. Then Ashta Shukra Doshas given. But Acharya Sushruta mentions that Shukra Dhatu is not only for reproductive tissue. It can also responsible for Dairya, Chayavana, Dehabala, like that. By when we are saying semen analysis, it gives knowledge about like physical property, chemical property, microscopic, like that. With interpretation of these, we can improve the diagnosis and improve the treatment outcome of Ayurveda. So today we are going to interpret semen analysis. Before going to interpret semen analysis, I would like to just brief out the male reproductive system. First, starting with testis, it has got several loops called seminiferous tubules where the testosterone from a Leydig cell and Sertoli cell responsible for production of the spermatozoa takes place. Once this spermatozoa production and development takes place in testes, then they will attain its first motility in epididymis. Later, this continues as a vasa differenza, goes into the pelvis behind the bladder, then along it connects with seminal vesicle, opens into prostatic urethra. Soon again, it will continues as a membranous urethra, then continues as a penile urethra. And then what is the importance of this seminal vesicle? Seminal vesicle has importance. It secretes fructose, which is very important, considered as an energy and provides like nutritive for spermatozoa. Now, then what is the importance of this prostate? Prostate responsible for acidic, and it also secretes some enzymes that which are responsible for coagulation and liquefaction of the semen. Coming to spermatozoa, spermatozoa has got two important features like head and tail. Head has contains acrosome and nucleus. Nucleus is a whole chromatin, whereas acrosome contains enzymes which are responsible for breakdown of the zona pellucida. Like that, tail has responsibility of motility of spermatozoa. These are the two important structure which are necessary for the spermatozoa. Coming to semen, semen isn't just like suspension of spermatozoa in a seminal fluid. It has got different contributions from different part of the male reproductive part. Like testis contributes about 5%, whereas seminal vesicle contributes about 80%, prostate contributes about 33%, bulbourethral and urethral gland contributes about 5%. This seminal vesicle, by secretion of the fructose, it will responsible for the movement and nutritive for spermatozoa. Like that, prostate is responsible for enzymes which are responsible for coagulation and liquefaction of the semen. Whereas bulbourethral and urethral gland secretions, they are all just like lubricating. Coming to interpretive of semen analysis, like first we'll see physical examination, color and appearance. Normally it is grayish white and opaque. Sometimes it might be pink because of small amount of blood, and it might become dark red if there is a more amount of blood. If there is any previous blood, then it appears as a brown, like that. If there is any appearance of like turbid, then there is a chance of any inflammation over the male genital tract. Next is viscosity. Viscosity is normally like can be poured drop by drop, but also it can be estimated by like with a standard pipette of 10 centimeter having a zero point 0.1 drop, and it will allow to continue drop from one end to another end. Then the viscosity can be calculated. And volume, normally it is 2 to 5 ml, less as 1 ml, and greater up to 10 ml is also regarded as normal. Liquefaction time is 20 to 30 minutes is normal. Coming to chemical analysis, pH lies between 7.2 to 7.8, whereas if it is more or less, then prostate has function to alter it. So if there is any pathology in prostate, that responsible for change in pH. Next, coming to the fructose. Fructose is needed for spermatozoa, which is secreted by seminal vesicle. Coming to next is like microscopic examination. Most and important part of semen analysis is sperm count. Sperm count, normally it ranges between 15 to 300 million per ml. Sometimes there are some pathology like aspermia, which is rare, like there is absence of ejaculation, and also azoospermia, where there is absence of spermatozoa in semen, and lastly like oligospermia, where there is a decreased number of spermatozoa in semen. Also with this, when it comes to sperm count, it is important to rule out like mumps architis, whereas prostatitis and hypothyroidism like conditions. Next is like motility. There should be at least 60% motility should be there. Less than 60%, like it might be end up in more chance of like infertility. After fourth hour of collection, every hour there will be 5% reduction in the motility of the sperm. What about morphology of sperm is like up to less than 20% is regarded as normal. If it is more than 20% of abnormal morphology of sperm, then it might be leads to infertility. Other findings also there, like pus cell. If it is more than 2 or higher than 8, then it suggests that there is an infection. Whereas in case of epithelial cells, even it is more nothing significant. In terms of red blood cells, like if it is more, we need to suspect about TB of the related male reproductive tract, or any rupture of vessels, you have to see, or any estrogen secreting tumor, there might be contributing to this. If there is a trichomonas present, then it leads to trichomonas infection. With this information, we'll now move towards Shukra. Like Shukra, it is formed after like Uttara Dhatu from Rasa. It is the last Dhatu. Acharya Shushruta has explained very beautifully, like how Sarpi is present in Payasi, how Buddha is present in Ikshu, like that. In Sarva Praninam, Sarva Sharira Vapini, Shukra is present all over the body. And this will helps to explain the whatever the Shukrakshaya Lakshana explained by Acharya Charaka. Coming to Shukra Guna, as we know, it is Snigdha, Gana, Pichila, Madura, Vidhayi. Like, and Shuddha Shukra Lakshana quoted by Sushruta, Spatikavam Dravam, Snigdam, Maduram, Madunandicha, Shukramichanti Kechitu, Tailakshodram Nivam, where modern appearance, like modern semen analysis has told, like viscous and opaque, that is Spatikaba. Majority of the lakshanas have told are similar in nature. And how many time does it takes to form Shukra? Acharya Sushruta tells it takes about 1 month, whereas Acharya Vagbhata tells about it takes 1 week. Shukra Karma, this is very important from Sushruta. Shukra is not only responsible for Bijartha, it is even responsible for like Dairya, Chayavana, Preeti, Dehabala, Harsha. So it has got multiple role apart from Bijartha. Now coming to most important part, like Shukravha Sroto Dushti Karana. What are the Karanas that responsible for Shukravha Sroto Dushti? Apart from like Akala Yoni Gamana, Nigraha Atimaituna, Shukravayini Dushanti, very important is Shastra Kshara Agnivistata. In current days, we can understand like Shara is the leading cause for Shukrava Sroto Dushti Karana. Then what we might like consume every day, like Shara in the form of baking soda, whatever we are eating outside every day. Then Shukra Kshaya Karana, also mentioned by Acharya Charaka, like age process, Jara, Chinta, most important due to this urban lifestyle, sedentary, and lack of dinacharya, person having more chinta will lead like Shukrakshaya. And also be like Vadi, which are chronic in nature, those are also responsible for Shukrakshaya. And he also mentioned like Anashana, not taking proper food. It is also responsible for Shukrakshaya. Shukrakshaya Lakshana, coming to Shukrakshaya Lakshana, we know Ashtanga shlokas, but Charaka has given not only related to Shukra, he has also given in general like Daurbalya, Mukashosha, Pandutva, Sadhana, Shrama, Klaibya. These are the other important Lakshanas where we can see in Shukrakshaya. Also, there are some Shukra Pradoshaja Vikara. If Shukra is not Shuddha, it might end up in other problems. Like, very importantly, like Kliba, Alpa, Virupa. Whatever the progeny is developed, it will be like Alpayu or it might be Virupa. Sometimes, Na Chasya Jayate Garbha. There won't be formation of Garbha itself. And sometimes, even if it is formed, it will be lead to a repeated abortion. So by this, we'll have concluding this Shukra. Now, also last, that is Ashta Shukra doshas. Acharya Charaka just mentioned like whatever the physical characters we are seeing, like Fenila, Tanu, Ruksha, Vivarna, Puti, Chila, like that. Whereas Vagbata, first he mentions like based on dosha, Vata, Pitta, Kapha. Later, based on combination of two dosha, he mentions Kunapa, Granthi, Puti, Puya. Very importantly, he mentions Kshina dosha. Now, with knowledge of like Shukra and brief knowledge about of semen analysis, we'll combine and interpret. First and foremost thing is color and appearance. Normal finding is like grayish white and it is opaque. Like what we have seen is Patikaba, that is Snigdha. If there is an appearance of turbidity, then it infers that like pitta aggravation is there because of inflammatory or any infection. If it is associated with any other dhatu like rakta, then it is hematospermia. Coming to next parameter, viscosity. Normally, it is poured drop by drop. Like viscosity is by because of Pichila guna, and it can like Taila Chaudra, Niba. These are the lakshanas can relate with viscosity. If there is a viscosity is increased, what it leads to aggravation of kapha dosha. So we have formulations like different. Like I would like to break down one formulation according to the condition. Suppose if there is any increase viscosity, then aggravation of kapha, gomutra haritaki will work better. How? Gomutra, as it is Katu, Tikshna and Ushna, also having Shara property, which is opposite of the Kapha, so it can nullify the Kapha Guna. Also Haritaki, which is Pancharasa, Alavana, and it has Ruksha Ushna Guna, so which is also opposite of Kapha. When if there is a viscosity is decreased, it understood that it is a Tanu dosha, like Ruksha, Lagu, Chalaguna are increased. In opposite of that, we need Snigdha, Guru, Madhura. The best and best is by Gruta form. Which Gruta to take, like Kalyanaka Gruta and Falagruta? Why in Kalyanaka Gruta, Falashruti it is mentioned that for Pumsavanam Param, it is mentioned like Kalyanaka Gruta. And whereas in Falagruta, he has mentioned like Shukra and Artava Pradosheshu Falagrutam Prashasyate. In liquefaction time, it is normally about 20 to 30 minutes. Also, it can be understood in terms of Ayurveda like Pichila, Gana, Snigdha, and Drava. For example, if there is any delayed liquefaction, then it understood that like kapha aggravation is there. So we need to bring up Vilayana Karma with Dravya, which is having Ushna Virya. Also, we should take care that Ushna Virya should not destroy the or it should not cause harm to the Shukra. So it should also have Rasayana property. Then best drug of choice is like Saubhagya Shunti. In case of increased liquefaction, where there is a Kleda Ruddhi is there, so which is similar like that of the Kafaja Prameha, so we need to follow the Kafaja Prameha Chikitsa. The drug of choice is like Shilajit, provided that genuine it should be there. Adulterated might not be giving good result, and we need to find a genuine. Next is like seminal calculus. Seminal calculus, drug of here formulation is Veerataradi Kashaya. Why Veerataradi? Veerataradi because of it is Shmarigna, Sroto Shodaka, Shotahara, and Shukrala. It is beneficial. And also it is mentioned that it clears the Mutragata, Mutrakruchra, and Rujahara. So in seminal calculus, there is chance of seminal cramps. So it can take care of all symptoms. Coming to pH, pH is normally between 7.2 to 7.8. If there is like less pH, indicates that acidic in nature, causing daha. So in that case, we can choose like Uttarabasti, best formulations like Vidaryadi Gruta, Dhanvantaradi Gruta. In case of pH is increased, Kshara, and we know that combination of Kshara and Amla result in Madura. So formulations like Panchagavya Gruta, Mahatikta Gruta are beneficial. Fructose, as fructose is essential for spermatozoa, for motility and nourishment. So if there is a decrease in fructose, we need to do Brahmana karma like Vanari Gutika and some other Avaleha Kalpana. Whereas especially in Vanari Gutika, it has contains important ingredient that is Kapikachu, which is Madura Ushna Madura. Madura Rasa, Ushna Vira and Madura Vipaka helps in Brahmana karma of the semen. Next, most important, sperm count. Normally, it ranges between 15 to 300 million ml per ml. If it is a low count, then oligoazospermia, where we can see that there is a aggravation of Vata dosha along with Pitta dosha. In case of azospermia, there is a severe aggravation of Vata dosha. So along with that, we need to maintain Prakruta karma of the Vata. Like Vata, Vayur Vibhajati. Vayur is responsible for Vibhajana, which is critical for spermatogenesis. So we need to take care of Vata, that is Prakruta Vata karma. In Charaka Sutra 4th, we have like Shukrajanana Mahakashaya, but unfortunately, majority of the drugs have extinct. Mudgaparni, Mashaparni, Ruddharuha, Jatila, these are available. Also, like we have alternative options. If the condition is of like Madura Shita, Madura, for example, it is having Pitta predominant, we need Madura Rasa, Shita Virya, Madura Vipaka, then drug of choice like Gokshura and Vidari Kanda. If there is a Kapha predominant, we need drugs like Kapikachu, which is Madura Rasa, Ushnavirya, Madura Vipaka. Also, it is Rusya in nature. And very importantly, Ashwagandha, which is Katurasa, Ushnavirya, Madura Vipaka, help in Kapha predominant condition. When it comes to motility and abnormal forms, we need like Shukra Shodhana Gana. In this Gana, like Kushta is extinct, rest others are available. So these are the drug of choice. Next parameter is like red blood cells in semen. We can understand Rakta along with Shukra in two perspective. First thing is like we have seen in Shukra Kshaya Lakshana. If there is a Shukra Kshaya, Shukra Janana has to be done. If there is a like normal Prakruta, if the sperm count is normal, then we need to think of Adoga Rakta Pitta. Adoga Rakta Pitta are caused because of Tishna and Ushna Guna of Pitta, where we need to follow Adoga Rakta Pitta Chikitsa. We need to take care of Pitta Shamana, also Rakta Prasadana. Formulations like Vasavaleha, Vatola Mulavaleha, Ushirasava are beneficial. And coming to conclusion, I would like to conclude by interpreting this semi-analysis in terms of Ayurveda, we can enhance the diagnosis and to provide better treatment. Also, we can track the treatment efficacy. I would like to thank you all for patiently listening and giving for this opportunity.
Thank you so much, sir. As we near the end of today's enriching webinar, I now invite Dr. Saurabh Kokotnoor, sir, the visionary founder of Tadvidya Sambhasha Parishat, to share his concluding remarks.
ज्ञानानन्दमयं देवं निर्मलं स्फटिकाकृतिम् आधारं सर्वविद्यानां हयग्रीवमुपास्महे। उपस्थिताः सर्वे मान्यवराः ज्ञानवृद्धाः च अपि वयं नमस्कारं समर्प्य राष्ट्रीय आयुर्वेद दिवस समारंभे आयोजित तांत्रिक विषय व्याख्यानमाला तस्य समारोप स्तरे केचन आयुर्वेद विषयेषु ज्ञान व्यवहारं कृत्वा इति आशया इदम् आयोजितवन्तः। This webinar was just to introduce our Tadvidya Sambhasha Parishat forum to the globe, which has already spread. But I was very, very fortunate. Through various modes, I came in contact with many people. In 2024 December, during World Ayurveda Congress, I met our respected Prasuti Tantradnya and today's speaker from Sri Lanka, Madam Sajivani. We both were given our accommodation in the same lodge, and during our breakfast and dinner we used to meet together at the hotel premises, and there I met Madam and we were discussing, and I thought, as it was planned to be an international event, let us have a known personality with expertise, having done with so many great works in Sri Lanka for the field of Stri and Prasuti Tantra. Madam had come to this and she delivered a very interesting topic with case studies, records, reports, and to establish the concepts with evidence. She struggled hard, and it denotes that her dedication towards Ayurveda and its growth. I'm very, very thankful to Madam Sajivane for being with us. And when I was talking to her, I made an appeal to her to introduce me to Dhammika sir, because I am having close association with Shri Dhutvarpeshwar Company Limited for at least a decade, and very closely associated since 2 years with the concept of Jyotishmati, being guru for the whole nation. I have traveled, and I came to know about Dhammika sir's interest in quenching the need of Ayurveda Jnana to the localites of Sri Lanka country. And when I spoke to Madam to introduce me to Sir, she readily agreed. She shared Sir's contact details, email address, and she spoke to Sir taking time out of her busy schedule, she introduced Damika sir to our forum. And when I spoke to him, sir gave me a date and time that we both will be talking, and we missed. I really thought that when sir said at this time on this day he will call me and he'll talk, I was holding myself and waiting for his call. When I did not receive, I thought he must be busy or he may not be able to attend for the today's event which is planned. But the next day, sir gave me a call and he was very happy to know about our forum and our events which are planned. And he readily agreed to be the keynote speaker for today's event. Very, very pleased to have Damika sir being honored with a prestigious post in the government of Sri Lanka, being the first former commissioner for the Ayurveda sector in the Ministry of Health of Sri Lankan government. He is very down to earth, and we are pleased to have Damika sir with us. And he has shared his insightful thoughts regarding global reach of Ayurveda with his mission and vision. The first resource person who spoke to all of us was Dr. Rekha Prasad, who is basically from my place, that is Hubli city. She studied her full qualification MBBS and post graduation is from Hubli itself. Later, she settled to Australia, and she came to me 4 years ago as a patient to correct her lifestyle. She had a very bad Amlapitta Lakshana, and as Dr. Aditya was mentioning about Bhasma Prayoga, I didn't do Bhasma Prayoga in her because the cause was very fine, that she had a habit of Pratarambupana and Atyambupana in her daily life. I just dragged both of them. I stopped Pratarambupana in her routine practice, and I also asked her to restrict your water intake to your body's demand. And listen to your hunger as per your body clock, biological clock, rather to that of wall clock. She improved a lot with that, and since then she is associated to me and my forum. So, being an international event, I thought to have Dr. Rekha Prasad with us. In her busy schedule, she joined our event and delivered a very good, insightful thoughts. And very shortly, the forum of Tadvidya Sambhasha Parishat is going to collaborate with Ministry of Health from various universities which are undertaking from Australia to initiate collaborative works officially. Very shortly, it will be announced to the forum, and please stay awaited for this. Dr. Aditya is a very gem of person, very younger to my age, possibly 10 years younger to me. I invited him to our Tadvidya Sambhasha Parishat International Conference live in the month of Jan 2025 as a speaker. Then he was appearing for his final MD exam. Though he was very short time to appear for the exam, he was busy with his preparation. He came all the way from Dadar to a very poor village where he stayed with us. He enjoyed the time, and he was the first person to start with the session on the day of Tadvidya Sambhasha Parishat conference. Now also I thought ki we must have Dr. Aditya, because in his regular YouTube classes or Instagram reels and stories, he posts so many bhasma and rasaushadhis in his practice, and I am happy to say that in my clinical practice, when I get difficulty with skin, I my first call off late is going to Dr. Aditya for his humble communication in a way possible to his capacity with his schedule he gives me, and I'm very very privileged to have Dr. Aditya in our forum. And I am happy to know that we are the first to give you a platform as a speaker for offline international stage as well as online international stage. And Dr. Aditya, it's a promise from our end that you will be a special invitee to most of our events, or rather, we should call all our future events. Please keep your dates booked as soon we publish our events on the social media. And the fourth speaker, Dr. Sanjay, is my own student, my child. He spent very good time with me as a student from first BMS till internship. He stayed at my house like Guru Shishya. We were discussing every day, and we have worked hard to bring Tadvidya Sambhasha Parishat to this level with all other colleagues who are working for this journey, including Narayan, Nitin, Jannavi, Harshita, Jivita, and other members. He was Sanjay was interested, and he was presenting a national paper on Shukra Dhatu and its interpretation through modern parameters. And he discussed with me, because that's an area of interest of mine in clinical practice. So I asked him to take up the same topic to present as a speaker in our own his own forum. Possibly it is the first platform of my student being a speaker in the international forum. Sanjay, keep it up, and I extend my gratitude to all the resource persons of today's event. Thank you. Over to you, Jeevita.
Thank you so much,
Thank you
sir.
so much, sir. Thank you so much, sir. Now I call upon Dr. Nithin for to deliver vote of thanks. Thank you, sir. With this, we come to the conclusion of today's international webinar, Ayuh Jagath. On behalf of Tadvidya Sambhasha Parishat, we thank all our speakers, guests, and participants for making this event memorable. Wishing you all a good health, peace, and eternal